Among the three macronutrients that are available to us, carbohydrate, fat, and protein. Protein is one component that forms the cell membrane and involved in the enzymes, involved in the hormones, and it is not commonly used for energy production. So misconception, protein does not contribute to the energy contribution, but it does contribute to rebuild the muscles if they have been broken down during the exercise program. We call it as rhabdomyolysis. So these broken muscle fibers are required to be rebuilt, reconstructed again, may require protein support. Now, among them, the bodybuilders, those who are explosive movements, possibility of muscular tear or not tear, the word must be lysis, that is breakdown of muscle fibers, which usually may cause muscular soreness if you are not accustomed to that activity. Now, protein requirement is based on the kind of activity you are involved in and amount that you are used to on a regular basis and how you can gradually increase. So for every kg of body weight, 1.75. It used to be 1.25 to 1.5. Now you are putting 1.75 grams per kg of body weight is all that is required to be taken. So if you understand in an Indian diet, that can be idli, sambar, dosa, sambar. There's always a dal that comes in. Protein content does seem to be high. Even rice, it's going to be sambar again. It's dinner, it's going to be again pulses in some form or the other. So we need to understand the protein content in Indian environment seems to be more. But a common impression that has been made today due to various exposure for us in the media and otherwise, not so much in a scientific environment, we find that there may be a requirement for protein when they are competitive athletes, when they are recreational athletes, and the food that we eat need not be balanced. That is when the protein replacement or supplement comes in. Now, among them, the whey protein, which is being used more common today, because during the formation or making of a cheese, you get the milk product, a byproduct, which is the whey protein, easily digestible, absorbable, and available is what is talked about. It's basically from milk. Understand when you take a lot more protein, it will produce a flatulence. The intestine or the stomach will stretch. So people who don't have the enzymes to digest the proteins, possibility of them going through a gastric embarrassment or an intestinal stretch which causes pain, diarrhea is going to be high. And because there is a nitrogen content that is high, you need to hydrate yourself more because the urine that is formed requires more water to be less concentrated. So those who are taking a protein supplement, it's essential that you hydrate more and allow the urine concentration to be less. Otherwise, because you are sweating, it can hurt the kidney because the nitrogen content is high. How come it can hurt the kidney? Not carbohydrate, not fat. No, protein can, because the nitrogen is the main reason for which the urine is formed. The nitrogen is very poisonous. It can't go through the normal intestinal canal and move out. So it is taken out by the kidney and brought out in the form of urea. So 1.5 liters per day is an absolute requirement as water input to make sure this nitrogen doesn't bother you. If you drink less than that, you are already asking for trouble from the renal tissue. Now, when you are taking more protein than what you do normally, possibility of this water being not optimal enough to take it out, again an urinary concentration will be high. If it is repeatedly done during your exercise, your renal tissue has reduced blood supply and thereby possibility of a renal damage when a sudden increase happens as the blood supply comes back to normal. So keep in mind that whether protein supplement is required or not dependent on all this, that you have to hydrate yourself, because the actual word that the protein requirement is absolute is, there is no complete proof, nor can we disprove it. There are so many stories on that. I would say if you are a competitive athlete who's keen on improving performance and didn't improve until then, you may choose to use a protein supplement. So when you are exercising, the hemo concentration, how much blood gets concentrated, is to be understood. If you don't take enough water, some of the organs that are in a vasoconstriction. What is a vaso? The blood vessels constrict in all the organs except the brain, the heart, and the lung. Brain, heart, and the lung do not have any reduction in their blood supply, but all the organs, the intestines, the liver, the spleen, the kidney, have a reduced blood supply. Once the exercise is done, the blood supply is re-established, and there's going to be high amount of usage or removal of the toxic or the waste products that need to be moved out of the body. Now, if we don't drink water, the blood is already concentrated. So what the kidney comes into contact is amount of concentrated blood with all the nitrogen content entering into the kidney can be injurious. So the glomerulus, or the small structures that form the urine, which is the functional structure and functional unit of the kidney, seems to be hurt and allow the protein to leak through the glomeruli. And those are dangerous, causing nephritis or damages to the nephron, which can cause a permanent renal damage. It doesn't happen in a single day. If you take it for more than a few years, possibility of the renal damage is going to be there. So nothing happens in a year. Nothing happens perhaps tomorrow, but it may take few years to see that happening. So when you are on a protein diet, ensure what is the concentration of the urine, very important to know.